Hi, everyone. We are going to talk about the most common areas that we see bleeding in people who are on blood thinners. There are a number of different blood thinners which are prescribed, ranging from the lighter blood thinners like aspirin to the more quote-unquote heavy-duty blood thinners like Eliquis or Xarelto. It used to be warfarin. So I will go first. The most common area that I see concerning bleeding in my role as a hospital doctor is I see people on these blood thinners and they get to the more extremes of age. So I'm talking about people in their late 80s, 90s, and they may be doing very well in other ways, which is fantastic. But their skin will get very thin and they will be very prone, unfortunately, to bleeding and bruising. And I see this a lot. And I can't tell you the number of times I will see someone in the hospital and they are in their 90s. Obviously, most of the hospitalized people at that age are quite frail as well, and they'll just be covered in bruises. And it's an awful side effect of blood thinning medications.
It is, and I see it enough in actually much younger patients. And so you lose a little bit of fat under your skin. Skin gets a little thinner, so even whacking it, you burst a little blood vessels. Sometimes it actually looks a lot worse than what's actually going on, and so that's important. You know, the other thing that I see a lot is nosebleeds. And so we call it epistaxis is the medical terminology, but it's just recurrent nosebleeds, especially in the colder winter months, and really can be quite scary for people because the blood comes out a lot.
Wow.
And so really what happens is the lining of the nose gets really dry during the winter. It's colder months and the skin cracks, and that crack in the nasal mucosa can cause a little bleeding, and you're in a blood thinner, and it comes out a lot. And so,
Interesting.
So I always tell patients, never put your head back. You'll swallow blood, put your head forward, squeeze the tip of your nose, but also see an ear, nose, and throat, primary care, or if it's really bad, urgent care, they can really put a stop to that quite quickly.
Yep. And have you been in a position where you've recommended, because of ongoing nosebleeds, I mean, it's all very well seeing an ENT doctor, but have you been in a position where you've said, look, we just have to stop the blood thinning medication? I'm assuming it's usually something like Eliquis or warfarin we're talking about.
Yeah, sometimes it can be on aspirin, but a lot of times it'll be on Eliquis, Pradaxa, Xarelto, or warfarin, which personally I don't use much anymore. But there is a time where it's a recurrent nosebleeds actually can be really quite dangerous, and so there is an alternative out there for people who may need it for atrial fibrillation called the Watchman device, and that's something that is very readily available with information out there, and we'll probably have that in another podcast again soon.
And that is to lower
it's an alternative
the risk, and they won't need a blood thinner.
Yeah, it's a procedure that really is almost equal to being on a blood thinner and getting you off of it. And so it's an insertable device into a small chamber of the heart.
Very
that
interesting.
Reduces clotting.
I'm seeing more and more people with these devices because the incidence of atrial fibrillation is going up. I mean, I've frequently had to deal with situations in the hospital where, and it's so sad when you see these people covered in bruises.
No, it's awful.
And they've been becoming more anemic. And we have this discussion with them and their families, and we'll say, look, this medication is being prescribed to lower the risk of a stroke, but you're becoming anemic and bleeding everywhere. So would you rather stop that medication? And again, it's always talking about the risk of stroke versus stopping the medication. Or if we stop the medication and stroke, or versus continuing the medication and having more and more issues. But a lot of people elect to stop it for those reasons, because particularly when we're talking about people's older relatives, and if somebody's becoming more frail, they will say, well, why are we doing this and putting them through this?
It's what affects someone every day. It's really, really important. And so again, blood thinners, there's a tightrope on it. So too much in the wrong situation can cause major life-threatening bleeds, and too little sometimes can cause strokes. But again, balancing it out and just going over the risk and benefit of it.
Yeah. And we wanted to make this video to really emphasize that, yes, these blood thinners have problems with them. Fortunately, those problems are less common, but when they do happen, it really sticks with you. I wouldn't say that everybody's on the blood thinning medication has nosebleeds or lots of bruising, but we see it enough for it to register. And the take-home message is, if you or a loved one is on a blood thinner, please watch out for these effects of excessive bleeding. And if the problems are particularly troublesome or requiring constant medical intervention, then have a discussion with your doctor on the pros and cons of just stopping it. And sometimes in life, you have to take that extra risk because of all of the problems a particular strategy is causing.
It is. You just have to analyze your plan of care and just make sure that the benefit outweighs the risk.
Yeah. Okay, everybody. We hope that was helpful. Thank you for watching.